both. Caitlin, let me start with you. There was back and forth about when this guidance was going to come out, if it was going to be, if they were going to be very, very risk averse in what they told folks. What's your reaction to what the CDC unveiled today?
I'm quite pleased with it. I think it's really exciting for people to have a clear path forward to get back to a normal life. It's a little bit on the conservative side, but I think that's good given the data we have available. And I think going forward, we'll be able to have a lot more flexibility to do things that are important to us when fully vaccinated.
When you say touch on the conservative side, Professor Rivers, what do you mean?
Well, the CDC guidance really hinges on whether or not someone who is fully vaccinated is able to transmit the virus to someone else. We know the vaccines are very good at protecting the person who is vaccinated. It's not as clear yet whether someone who's vaccinated can pass on the virus. And so the CDC is recommending that if you are with people who are fully vaccinated, then you can go ahead and live normally. If you are with someone who is at low risk, you can also socialize without masks or social distancing. But when you start to add on more risk factors, if you're with someone at high risk of severe illness, if you're in a group, they're still recommending that you wear a mask and that you distance. And that's in recognition of the fact that we can't be confident yet that the vaccine is actually protecting other people.
And Dr. Rivers, I mean, one of the things that the CDC said today that I thought was interesting and relates in some ways to some things I've seen you write about and others is just the notion that giving people a sense the vaccine really does give them some protection, which is grounded in the data, is also a key part of incentivizing vaccination uptake. I mean, if the message is go get vaccinated and then you got to go back to doing everything the way you were before, that's a tougher carrot than go get vaccinated and you could hug your grandkids, right? And the CDC actually acknowledges that in the guidance today.
It's true that this uncertainty about what exactly the vaccines do as it relates to other people has been difficult. Right now, about 10% of people in the US are fully vaccinated, which is an amazing achievement, but it means that 90% of people are not yet vaccinated. And so we do need to take steps to protect everyone else. But for the people who are fully vaccinated, it's good news. We have a lot more flexibility now to do things that are important to us.
You know, the part of the package passed today is targeted money to go out to states and localities to partner with community groups to do whatever you need to do to get inside the social networks of folks to give them a message.
That's right. A lot of the public health power in this country is at the state and local level. And that's because state and local officials know what works for their community and how to reach people in those communities. And so I think empowering state and local officials to really get out there and reach people, I think will be really critical going forward. And I do agree with Dr. Jha that as more and more people will get vaccinated, people who aren't sure yet if it's right for them will become more confident. And I think that will help a lot.
Yeah, I'm still not there, but I'm just chomping at the bit. Can't wait. Caitlin Rivers, Ashish Jha, thank you both. I appreciate it.